So the first step is simply to manipulate the foot again to appreciate the amount of eversion that the patient is experiencing, maximum eversion. As you can see, the incision doesn't need to be more than about 1 centimeter in length. And when you have a nice thin patient like this, you can simply just push your finger into the sinus and feel the puckering and get an adequate placement of the incision. On heavier patients, you would mark the lateral malleolus and then do a little bit more manipulation to figure out the perfect position for the incision. So again, we haven't made our incision yet, but I would like to state that under certain circumstances, prior to making the incision, we actually use an arthroscope to visualize the interosseous ligament. There's a ligament that exists in between the talus and the calcaneus that makes up the sinus tarsi, and that ligament has to be satisfactorily released in order to assure that the implant maintains position. So we'll use a scope, and sometimes we use smaller scopes, sometimes an ankle scope is fine, and we'll place the scope into the wound and visualize the ligament so as to make sure that the ligament is released. In her case, using hindsight, I'm able to know that the ligament release was satisfactory without the use of arthroscopy, and so this won't be necessary. However, this is a great tool, and we'll show you how to use this in future videos. The purpose of this video is simply to show how easy this procedure is. So the first thing we're going to do is simply make an incision and follow the lines right here. That's it. It's a tiny incision. And we'll basically just make an incision, a slightly deeper incision here to get through the subcutaneous tissues so that we can basically, at that point, get into the joint capsule where we have to put the implant. Now, it's as simple as just opening up the incision a little bit so as to get the portal into the joint capsule. And the next step is very simple also. All we're going to do at this time is we're going to take a special scissors, and the scissors should be sharp, and we're going to release the ligament inside here. Now this is a very simple manipulation and maneuver. I can feel it right there. The ligament was released very nicely. And once you know that you have release of the ligament, you're clear to actually put the implant in without worrying about the implant avulsing. So I can feel the ligament right now releasing very nicely. And this is, again, a critical step. The next step is to take the smallest size and pop it into the sinus. As you can see, I can get it right into there, and we can start our manipulation of the joint to make sure that everything is smooth. Now, there's something that Dr. Graham, the originator and inventor of the implant, calls the J maneuver, and that's simply just rotating the implant so that in a J-wise fashion, so as to figure the position of the implant or the sizer and make sure you're in the sinus. And as you can see, we've already affected the change we want. She's stopping now at about 7 degrees of eversion. Again, if we take the sizer out and we go ahead and we evert, she's way, way over. So simply putting the sizer in is a huge, huge component of correction. So now we'll go back in with the size 5 sizer again. We'll put it back in. Now we know in hindsight with this patient, we'd used a size 5 on the other side. So we already know that size 5 is working very well. We have post-operative x-rays that demonstrate this, and we can see that this is perfect. So that's simple. We simply ask for a size 5. At this point, I'll ask the nurse to open up a size 5 implant, and we'll put the implant into position. Now, there's one other thing we can do. Again, the implant comes packaged, and all we need to do is just make sure that it's a size 5, and then we're ready to go. So this little implant will go through this little hole, and we'll solve the problem of her excessive pronation. Before I put the implant in, I'll use a small rod. Again, this is a blunt rod, and we'll simply put it into the joint to follow the sinus tarsi. And this is really good to act as a guide wire to make sure that everything goes in smoothly. Now the implant will go over this. You can see that the implant's ready for insertion. We'll take a special instrument to insert the implant with. Pop the implant in. We can feel it enter the sinus tarsi, and we give it a couple of twists to make sure that it's in good position. We'll also test it to make sure that it's doing what it's supposed to do. Everything's perfect right now. I just want to feel the implant lock into position so that it doesn't move, and I can feel that right now. And that's just a matter of just the delicate turning of the handle. So we've got a locked-in implant now. I'm going to carefully back off the driver. I'm going to pull out the wire. And in less than about 5 minutes, and sometimes it's as little as 2 minutes, we're able to effectively control this person's pronation for life using an endoskeletal approach, making it possible for her not to need orthotics in the future and to just use her own skeletal joint to control her pronation. 3 sutures, and this procedure's done. So now I'll take 5/0 nylon. Usually we'll close with 5/0 nylon because it's a simple closure. And we'll simply close the wound. With 2 or 3 stitches. She's got such a small wound that 2 stitches will suffice very nicely. Once again, we can test the implant. It's working perfectly. We'll put a little dressing on this, send her home in a boot, go out and tell mom and dad that everything worked out fine. Procedure, usually the parents are surprised at the duration of the procedure lasting only 5 minutes. And that's the way to do a HyProCure implant using a very small incision in a sterile OR so that everything goes absolutely perfectly. Okay, so that's the HyProCure procedure. This last step is simple. We just take a fluoroscopic image of the implant. And what we want to see here is that the implant is a little more than 1 centimeter across the lateral wall of the calcaneus, and that the beak of the implant is going into the sinus tarsi and supporting the head and neck of the talus. It's a perfect position, so essentially 1 fluoroscopic image is enough to basically let the patient and the parents know that the implant's in good position. We'll lock the foot in a walking boot for a week or 2, and then the patient will be ready to go.